we are live. Dr. Mark Goulston, it is a pleasure. We've been speaking a little bit on Clubhouse. I'm glad that today we're able to get here and have a conversation about a subject that is near and dear to my heart. For those that don't know, you're the host of No Strings Attached on LinkedIn Live. You are also the inventor of surgical empathy, which is really something I want to dive into today. You're the creator of Design Thinking Leadership, the co-author of Why Cope When You Can Heal, the book that's out now, author of Just Listen, which became one of the top books in the listening world, and the One Man Show, and a variety of different things, TED Talks, Speaks, and so forth. You've been around the mental health space for a few days, I would say, right?
A few. And I'm really excited to be with you, DP. I just, it's interesting. I don't know if you can relate to this. For many years, I thought of myself as less than other men because at my core, I'm not an I, I'm a we. And the we meaning I'm always looking for people who are like-minded, like-spirited, like-valued to partner with, where we build something together, that helps people, maybe changes the world a little bit, saves a few lives. And I always felt less than other men because it's I take the thing. And you might say, Mark, we military are not lone wolves. I mean, we work in teams, and maybe you've been hanging out with these entrepreneurs who are masters of the universe, and they act like they don't need anyone. They need everybody. So I'm so excited about just the relatedness between us so far and where that could go.
And so right to it. Before I even ask the first question, can you tell us a little bit about how long you've been in your field? Just for those out there who may not know or may do a Google search for some of the things that you've done, especially with the latest book that you have, just to introduce you to the audience.
Okay, so I'm retired now, so I coach, train, teach counselors, parents, anybody who's worried about someone they love being in a dark place and maybe even a little bit suicidal. So I was trained as a psychiatrist. I am a psychiatrist. I'm just retired status, but it's closing in on 45 years. And a little bit about my background is I trained at UCLA in psychiatry, and I finished in 1980. So that's 41 years, I guess. And one of my earliest mentors was one of the main pioneers in suicide prevention. He was a quirky guy named Ed Schneidman. He co-founded the suicide prevention centers in Washington and Los Angeles. And he also was the founder of the American Association of Suicidology. And what would happen is I would meet with him at UCLA, and we developed a mutual fondness and respect for each other. And so when I graduated, here was my good fortune, is that before I finished training in 1980, I was going to get a fellowship in geriatric psychiatry, and it fell through a week before I finished. So I thought, maybe I'll just go out and, see what I can do. And Dr. Schneidman, who is this, one of the leading people in the study and also the intervention of people who are feeling suicidal, what happened is we developed this relationship. And so early on, a number of my patients were suicidal. I mean, conventional wisdom was, not to see more than one suicidal patient at a time because, the pain they're in, it can be exhausting. And about a quarter of my practice were suicidal because of Dr. Schneidman. And what would happen is he would do a consultation on the inpatient units at UCLA because a patient who was still suicidal needed to be discharged. So you might think, why are they being discharged? Well, they're not acutely suicidal, meaning it's in their personality. In the back of their mind is often this thought, well, worst comes to worst, I can always kill myself. And so a number of the people who were residents there, and I just finished, didn't want to see them as outpatients because they thought, well, if they're out of the hospital, they might just do it. And so Dr. Schneidman would go up and he would do a consultation, and he'd call me as he was seeing the person. And he would always call me and say the same things. He'd page me or he'd beep me in those days. I had a beeper. He said, Mark, this is Ed. I'm with this handsome young man. I'm with this lovely young woman. They're in a lot of pain, Mark. You could help them. See them. And then he'd put them on the phone and I'd have a conversation. And then they could be discharged because someone on the outside was willing to see them. But it was my good fortune, as I said, to not be working for an institution because my fellowship fell through. So here's what I noticed, DP. As I would be seeing these people, a number of them multiple suicide attempters, I started to listen into their eyes. And here's what I picked up, is that when I'd be checking boxes, have you been depressed? Have you been anxious? How long? What medications are you on? I started picking up that they were screaming at me with their eyes. And what they were screaming at me to hear was, you're checking boxes and I'm running out of time. And over time, the screaming through their eyes got louder and louder. So I put aside checking the boxes and I just listened into their eyes. And I'll tell you one episode that basically switched everything. I was seeing a woman that I'll call Nancy, and she'd made 3 or 4 suicide attempts, had been in hospitals 2 or 3 months every year for several years before I was seeing her. And she'd been discharged, and I was seeing her for, 6 months or so. And that was the longest that she'd gone without a suicide attempt or a hospitalization. I didn't think I was helping her. I mean, she'd come to the office, but I didn't think I was helping her. And when she was in the office, if you're me and I'm her, she'd be like this. I mean, she wasn't catatonic, but she'd be like this. And so in those days, once a month, I would moonlight at a state hospital. And moonlighting means you go in, you cover for doctors, you do admissions. And, if someone needed some intervention, you go to the various wards and it was Metropolitan State Hospital in Norwalk, California. And so sometimes you're up 30 hours, you're exhausted. And that in the military, sometimes you're up even longer than that. And so I was going to see Nancy on one Monday, and I think I'd been up, 30 hours or so. So I was a little bit wigged out. And so she's there like this. And as I'm seated with her, I'm looking at her like I'm looking at you. All the color in the room disappeared and it turned to black and white. So I'm looking out and the room is black and white. And I'm thinking, whoa, what's this? And then I started to feel this chill. And I thought, I'm having a stroke or a seizure. And because she wasn't looking at me, it wasn't rude for me to do a neurologic exam on myself because I'm a medical doctor, a psychiatrist, not a psychologist. And so she's looking at me like this, and I'm going like this, tapping my knees and whatever. And she's still looking like this. And then I thought to myself, I am not having a stroke or seizure. And then I had this crazy idea, maybe it's because I was overtired, but I had this crazy idea that I was looking at the world through her eyes and feeling what she felt. It was cold and black and white. So because I was sleep deprived, I blurted something out that if I wasn't sleep deprived, I wouldn't. Because what I blurted out is, Nancy, I didn't know it was so bad, and I can't help you kill yourself. But if you do, I will still think well of you. I'll miss you. And maybe I'll understand why you had to get out of the pain. And I thought to myself, I just gave her permission to do it. I'm screwed. Because I didn't know whether I said it or thought it, and I realized I'd said it. And it was at that moment that she went from this to looking at me, and she locked onto my eyes. Mm-hmm. And I thought she was going to say, thank you for understanding I'm overdue. So I got a little nervous. And I said, Nancy, what are you thinking? And she looked at me And she said, if you can really understand why I might need to kill myself to get out of the pain, maybe I won't have to. And then she smiled. And she held onto my eyes like I'm holding onto yours. And all the color came back in the room and the chills went away. And I said, Nancy, here's what we're going to do. I'm not going to give you treatments or tell you to do things that have already been tried unless you ask for me to do something, because they've been tried and they haven't worked that well. Is that okay? And she looked at me with a look that said, keep talking, I'm curious. And then I leaned into her eyes and I said, what I'm going to do is I'm going to find you wherever you are. And I'm going to keep you company there as long as it takes. Because you've been there too long alone. Would that be okay? And then her eyes watered a little bit and she smiled. And that flipped a switch in me. And so part of what I try to teach the world, and I have this book, Just Listen, behind me, which became the top book on listening in the world. It's in 27 languages. And at the core of Just Listen is to cause other people to feel felt by you, which is different than feeling understood. Feeling understood is better than feeling misunderstood. But feeling felt, if you've just felt alone in hell, all by yourself and it's getting worse, when you feel felt, you lean towards it. In fact, when I talk about suicide, I actually did a blog after Anthony Bourdain and Kate Spade, I think, died by suicide. And it's on Medium, and I think the title was Why People Kill Themselves, It's Not Depression. So it got it got 500,000 views in 8 days, and you can still find it. And I said, there's hundreds of millions of people who are depressed who don't commit suicide. There's hundreds of millions of people who lose a job who don't commit suicide. It contributes to it. If you're depressed, it can contribute to it. If you lose a job or a marriage, it can contribute to it. I said, but in my working with people who had felt suicidal, what I felt that they all had in common is they felt despair. And if you break the word despair into DES-PAIR, they feel unpaired with reasons to live. Despair. Hopeless, helpless, powerless, worthless, useless, meaningless. They all line up pointless to go on. And something that we need to realize is that when you're really feeling all those and you're feeling hopeless, death is empathic to hopelessness. Death is saying to you, it's like the sirens calling in mythology where they called sailors upon the rocks.
Yes.
I understand your pain. I'll take your pain away. And when there's no escape from it, you lean towards it. So death, you feel felt by the fact that death can take the pain away. And so what I realize is if instead of their feeling that the less alone only because death is saying, I'll take your pain away, if they can feel felt by you, they'll attach to you instead of death.
And Mark, I just have to offer that that's one of the first conversations that we had in Clubhouse, right? There's no cameras, there's just voice, and there's a power that's happening because people feel that they're actually connecting. That's the power of voice versus, a post that looks a certain way or social media and other ways that we've seen them. And one of the first things that we talked about was in all the conversations I've had with thousands of veterans, whether it be related to benefits or what have you, I've always coined a concept that when someone is in pain. I've seen that, right? And I've equated to saying that they're in a foxhole and they're deep in there in that darkness by themselves. And when I can relate that I've been there, the last thing I wanted was someone to be patronizing and say, DP is going to be all right, or give me all these things that, to your point, was detachment, right? I've dealt with depression, anxiety for a while, but at the lowest of lows, when that became a thought, there was something going on there, which goes to the point in the thesis of that decoupling that you mentioned and touched on. And in my way of relating to the veterans, one of the things I've always said is I'll sit there with you. And again, looking at now surgical empathy, it begins to give me it adds more words to my lexicon to be able to better articulate this. But at the time, I would say, I understand. And I'm just going to sit here with you. And literally, we'll just talk. And maybe it's just a conversation about what's going on or what your favorite food is, but I'm just there. And literally at some point or another, they would turn around and they would say, hey, I understand. Like, hey, let's get out of here. So tell me, DP, what did you do? And they started to gravitate. So I share this because understanding what surgical empathy does to me is just sitting next to someone in the heart of their pain, but not being patronizing or trying to be a savior of sorts, just saying, I understand this place. I've been here. It's not a good place to be, but you won't have to be alone. And to the point that gravitated them to then begin to extract conversation, reach out and say things like, so tell me, how did you navigate this space? And then the conversation began of modalities or therapies or different things that, again, may have worked for me. But now you can begin to seek that, but having that encouraging aspect. I love how you kind of coined that, because that's literally what I felt. I just sat there and you would just see that life come back to someone. I love how you mentioned being able to literally listen to their eyes, because we talk about it, that PTSD look where someone is just completely zoned out, and you don't see them there anymore. And I think for those out there who are listening to this may hit you, but you may know someone also in this. And I think there are some tactical things to be able to better relate, because I'm sure that's a question you get, which is, how do I even talk to my husband who came back different from Iraq? He never came back. Or my grandfather or my father, who's always been just kind of away, but no one's ever looked them in the eye. I've always equated to say, shake someone's hand, look them in the eye, and just ask, Mark, how's your day going? But just mean it and stay there, and you'd be surprised what the eyes give you back. So I want to just add that, because from the veteran perspective, I can relate to that. That made a difference for me. Many people talked around me, but very few listened and made me feel a certain way. And there's a power in that.
So I want to give you a taste of surgical empathy. Okay?
Yes.
Right here in real time. So imagine yourself and I'm not going to leave you there, DP. If I go in there, we're going to walk out. Yeah. But I want you to imagine yourself at a low point, and you're looking out at the world, and it's like your eyes are just kind of lifeless, and you're just stuck. So here's an example of surgical empathy. If someone were to say to you, DP, your eyes are telling me something. Would it be okay if I tell you what they're telling me? And you'll be like, okay.
Yes.
If I leaned in and said, what your eyes are telling me is, and you're screaming at me, don't you get it? I can't go where you're at. Don't you get it? I can't move. Don't you get it? I'm not being stubborn. I'm stuck.
Yes.
And I'm running out of time. And you're going to have to come and get me. And if you think I'm being resistant to treatment, well, F you. I can't move. So can you relate to that when you're looking at me like this? Can you relate to that message that that's what you're telling me? Yes. Is that I have to come to you because you just can't move?
Yes, because what everyone else has done is try to give me this medication. Take this to make the pain go away, but no one's pulling you out. It's like you're in a dream and you're screaming and you just can't get out of it. you're literally in this bubble and you can't breathe and you're suffocating under everything that you've been exposed to, the traumas, whichever they may be, wherever they came from, just completely detached, to where the thought then becomes, wouldn't it be better if I wasn't around? What if that drive, Mark, at 4:30 in the morning, I took that turn just a little bit harder? Would anybody notice? Would anybody care? Regardless of what people may think, that's where the voice now is starting to deafen to. Yeah.
I remember a woman, this is one of the most vivid pictures of that. So I was seeing a woman, and she said, let me tell you what my life is like. I am stuck deep in a dark cave, and I hear people drilling, and I hear the sounds of their voices saying, I think we found her. But what they don't know is they've drilled into a different mine shaft, and they're looking at a doll that they think is me.
Mm.
And I'm running out of oxygen.
Mm.
Welcome to where I'm at.
Mark,
Can you see that picture? Can you see that picture?
yeah. And I want to ask you, in that picture, is that sensitive to time? Can that doll be there for the past 5, 10, 20 years? That Vietnam veteran, that Persian Gulf veteran, that person that lost a loved one in 87?
Totally. They can be stuck there because, again, part of what I talk about in Why Cope When You Can Heal. And we have something in it called a 12-phase emotional algorithm. It's a terrible term, but we use the word algorithm because algorithm means if you follow X steps, it'll take you from A to B, and it'll pretty reliably get you to B. And so the subtitle of Why Cope When You Can Heal is how healthcare heroes of COVID-19 can recover from PTSD. It is perfectly transferable to veterans.
Yes.
Without changing one word. Now, the beginning of the book talks about all the horrors that healthcare workers have gone through, but you could substitute all the horrors that military have gone through.
Yes.
And so the way it works, to give people sort of a taste of it, is the 12-phase emotional algorithm. So see if you can track with what I'm about to tell you. There's even a slide that I sent you. Yep. We can show it, not show it, or you can reference it if you want.
Yeah.
And picture this. You're a healthcare worker or you're military, and you were trained to deal with anything except when anything happens. And that anything is beyond anything you were trained for. And so what happens is that's the trauma. And it's horrific. You feel horror because it's beyond anything you could imagine. If you're a healthcare worker and maybe, there's a few deaths in the ER, the ICU a month, and you just finished the shift where 7 people died, one of them your supervisor. You're exhausted and you go at the back of the hospital and there's all these storage trucks because they can't fit the bodies in the morgue. And so what happens is after the trauma, you feel horror. And then when you get a little breathing room, the horror sinks in and you start to feel terror. Then you start to feel fragile. And we call that the horror, terror, fragile trifecta. Mm. And if that sinks in, you start to feel an overriding sense of panic. But because you're duty bound, and because your coworkers, your fellow military, you're duty bound, you're not going to bail because they're not going to bail. And so what happens is, because you're duty bound, the danger triggers a burst of adrenaline. And NBA players can play on a fractured leg for a quarter because of adrenaline. And so because of that, the adrenaline comes in and enables you to push away those horrific and terrifying thoughts and feelings. Because if you gave into them, and you couldn't move because you'd feel an overriding sense of panic. And then after the panic, you'd feel paralyzed. So what happens is the adrenaline comes in, and instead of feeling the panic, you push away thoughts, you push down feelings, and then you suddenly can focus and function. You don't know how you're going to make it through the next 8 hours, but you've been up 48 straight. And superficially, you can feel superhuman, but inside, you know something ain't right. But you don't focus on that. You keep pushing through because you're in a war. And it continues. And then what happens is sooner or later, the war ends. And I mean, why would military, you're not in a war zone, why would you come home and feel depressed or suicidal? It's because what's happened is in order to survive, you took what was originally like a nice, calm little cat who just started screaming. And every time it starts screaming in your head, you put it in the cellar. And you put another one. And you put 10. And you put 100. And you put 500. And the insulin, not the insulin, the adrenaline kept the door locked. But then the danger and the adrenaline pass. And those 500 cats are just screaming. And you feel like if you open it up just a little bit, they're going to come through and eviscerate you.
Yes.
They're going to shatter you. And you'd rather be dead than shattered and never come back. So what happens, and this is where what we're calling re-traumatization avoidance. In the book, we talk about PTSD, but some of the people who are really, stuck on what does this have to do with PTSD? What's your evidence? This is not evidence-based. What's your control group? Well, my control group, for 30 years, I saw suicidal patients and none of them killed themselves. So that's my control group. Not evidence-based because I was too busy doing it instead of doing the research. So re-traumatization avoidance, when I've talked to veterans, and I've wanted to name PTSD re-traumatization avoidance, but I finally gave up on it. And what does that mean? When I've talked to people who are deeply traumatized, and I've said to them, look them in the eye, good for you. You're so courageous. You got over it. They look me back in the eye and say, I never got over it. What do you mean? I got past it. What do you mean? I'm not the same. Well, do you think you could go through it again? I don't know how or why I made it through the first time. I still don't know. And if I give it so I do everything I can to avoid that. I drink. I stay away from people. I try to numb myself. I like driving in my pickup truck until a car next to me backfires, and then I go through the roof because I'm driving in my pickup truck and I'm really kind of relaxing, and wham, that backfire happens and I just jump out of my skin. Of course, I can't protect myself from my nightmares. When you go to sleep, you never know what's going to want to push through. And so I don't sleep that much.
Yes.
So welcome to my life. And so what happens is the next step is after re-traumatization avoidance is disabled, or you recover. And disabled means you're still stuck there. As you said, you're still stuck in 1967. And you were some of the all who gave some. Sometimes wishing you were the some who gave all. So you wouldn't have to be here. And so you're disabled if you're just stuck there. Afraid to move forward, afraid that the next afraid that those horrific and terrifying thoughts and feelings will just take you down. Or we talk about how you can recover. And we see recovering different than healing. So recovering is good. Recovering is coping. And when you say to that person, good for you, you're courageous and you got over it. What they're really saying is, I recovered, I cope. It's better than not coping, but, I don't know peace. I know exhaustion. Yeah, I have happy moments. I don't know joy. And I'm tentative. I don't put 2 feet anywhere because I don't want to stir up those 500 cats. And so you can cope. But what we wanted to do is help people begin to heal. And you begin to heal by taking those cats out one at a time. And so we're creating pilot programs. And if people are watching this and there's interest, maybe DP, you and I can start some pilot programs. And what they simply are is, you're back from the war and you might change some of these steps. They're not written in stone, but we're going to share with each other. When was the first moment after basic training when you saw or felt something horrific? When did you feel, I'm trapped, but I can't leave? And you're going to share that. And you're going to get triggered. So if you look at the next slide, one of the approaches we have is something called the distress relief exercise and journal. And so I have one right here. And that's the same picture. So something you don't know about me, there's always a backstory. I dropped out of medical school twice because I probably had untreated depression, maybe PTSD, I don't know. But the second time I dropped out, they wanted to kick me out because they were losing money on me. Because every time you take time off, they lose matching funds. So the first time I took off, I did blue collar jobs, which I still I remember fondly. And then I came back to medical school and it happened again. I was highlighting every book in yellow, but I really couldn't hold on to it, but I was still passing courses. And so what happened then is when I asked for another leave of absence, the head of the school who cares about funding didn't want to lose money on me. I can understand that. I maybe would have wanted to cut my losses with this kid taking a second leave. And I don't even remember meeting with him, but I got a call from the dean of students. That's the picture you're seeing. And he cared more about students than he cared about funding. And I think the head of the school sent me to him because he didn't tell me that they wanted to kick me out, but he didn't want me to kill myself. And so I get a call from that fellow over there, Dean Bill McNary. And he calls me and he said, Mark, this is Bill. You better come in here. And I go in there and I'm at a low point. I come from the background where you're only worth what you can do. If you can't do anything, you're not worth very much. And I could feel all those lesses, worthless, meaningless, purposeless. So he says, read this letter. And the letter's from the main dean. And it says, I've met with Mr. Goulston. I wasn't a doctor. And we talked about another career, and I'm advising the promotions committee that he be asked to withdraw. So they couldn't kick me out because I was still passing. I don't know how I was passing. And I looked at Dean McNary and I said, what does this mean? And he said, you've been kicked out. And I remember, and I'm not religious or spiritual, although people say, Mark, you got to be spiritual with all this stuff. And when he said, you've been kicked out, it's like I folded over. And it's like I'd been shot in the gut. And I know what that's like because I had a perforated colon about 15 years ago and I almost died. It was a few hours away and I folded over.
Wow.
And when he said that, I felt I was bleeding from my eyes. And I just kept going like this, looking for blood, but it was tears. And I think just the raw vulnerability and low point. So imagine hearing this, DP. So I come from a background where you're only worth what you can do.
Mm-hmm.
And I didn't think I could do much. And he says, you didn't screw up. You passed everything, but you are screwed up.
Wow.
But if you got unscrewed up, I think this school would be glad they gave you another chance.
Mm.
I said, what? I couldn't believe this. Why? I'm not able to function. And then he hit me with a different trifecta. So imagine, you feel useless and worthless, flirting with being broken. And he says, and even if you don't get unscrewed up, even if you don't become a doctor, even if you don't do anything the rest of your life, I'd be proud to know you.
Mm.
Because you have a streak of goodness in you that we don't grade in medical school. We should, but we don't. And you have no idea how much the world needs that goodness. And you won't know it till you're 35. But you need to make it till you're 35, and you deserve to be on this planet, and you're going to let me help you. And he pointed his finger at me, and I grabbed on to the offer. If he had said to me, DP, call me if I can help you, I'm like a lot of people with foolish pride, I would have gone back to my apartment, and I wouldn't be here today.
Yes.
But he didn't. And so he arranged an appeal, and I had to present, sort of kind of who I was, where I was, and apparently they saw some goodness in me too. I mean, he was able to convince them that, that I had something. And so the combination of someone seeing a future for you that you don't see, worth in you that you don't see, value that you don't feel, and they're going to bat for you against the establishment, it just flipped something inside me.
Mm.
And so I took a leave of absence, and actually on that second leave of absence, I went to a place called the Menninger Foundation, which is a big psychiatric center, which was then in Topeka, Kansas. Now it's in Texas. And I remember as I was driving there from the East Coast, I was thinking to myself, well, either they'll lock me up or I'll find out something or other. And then in the dead of winter, because, and I'll tell you, this is before your time, I think it was in 72 or 73, there was an oil embargo. And, and all the gas stations were closed down. And I remember I was driving across from Boston to Kansas. I was driving across the George Washington Bridge that connects New York to New Jersey. I was the only car on the bridge. And I was sleeping in the back of my car driving to Kansas. And I got there and because I just needed to get away from the East Coast and the West Coast. I had gone to college in the West Coast. I grew up in the East Coast. I just needed to get away from it all. And then there in the middle of Topeka, Kansas, in the middle of winter, for some reason or other, I was able to connect with schizophrenic farm boys, and I'd never been on a farm. And it was just weird. And then some of the people at Topeka State Hospital, this is how naive I was. I would say to the other psychiatrists, I'd say, is this legitimate? I mean, I walk around with them in the snow and, is this real? Because I'd never seen anything like this in medical school. And they said, no, this is a legitimate field. Yeah, we give the medicines, but no, talking is a big part of it. And I remember they said, you have a knack. I don't think I'd felt like I had a knack for anything for years.
Yeah.
And so I was able to come back, finish medical school, went on to train at UCLA, and I went 12 years without taking a sick day. I would see patients if I had 104 temperature. I'd throw up between them because I was afraid if I dropped out for one day, took a sick day, I'd drop out forever. So I was superstitious, and I remember the breakthrough about 12 years later when I felt like I was dying and I took a sick day. And I didn't fall through the cracks. I mean, I came back 2 days later.
Yeah.
So part of my secret is that I just paid it forward for 30 years. I looked for and saw the goodness in people. And then like Dean McNary grabbed onto my neck, I grabbed onto theirs, and I said, "You're not going anywhere."
It's funny, Mark, you say that, because one of the things I've taken away from the military, a bunch of sayings. I had a senior non-commissioned officer who would always say, "There's good and then there's gooder," and that was a funny thing he would kind of say, and I always took away a parallel point of goodness. I personally believe in my ethos that there's a goodness inside of us, and when I say it on some of these live events, or I'll say, there's a goodness that someone is bringing forward, or don't hold that back because we need that, it usually gets a chuckle, because most folks kind of look at it and don't identify that there is goodness inside of them, especially in the veteran community, to be able to relate to that, right? It can be kind of tongue-in-cheek of like, okay, I got a face made for radio, it's kind of like a tongue-in-cheek thing, but the reality is, to that point, there is a goodness. And I think that's just a salient point that you made, that I think many folks can relate to, or rather need to hear that to understand that there is a goodness in there. But that goes back to the point that you've masterfully said. I also want to add, one of the things I've said profusely is that the medical field, as a veteran with the VA and so forth, sadly has moved from a place of bedside service to desk side service. And you touched on that when you stopped checking a box and started looking in someone's eyes. I can tell you how many times I've been to the doctor, psychologist, therapist, and literally it's like, will you look at me for a second? Like, just look at me for a second. Like, I understand you have to do the paperwork and the red tape and the bureaucracy, and you have to justify, but my file is this thick, but not once have you looked at me. And the days where you knew the doctor by his first name, and he knew your history, and he asked you about your family and so forth, those days in this technology-driven world, the pendulum has swung to the other side. And I think we need to go back to a place of bedside service where someone looks you in the eye and says, "How are you feeling today?" Not give me on a 1 to 10 how much the pain hurts. Can't you see it? If you look at me, can't you see it? And that, I think, is part of what you mentioned, because for a veteran dealing with mental health is, I'm trying, Mark. Doc, I'm here. I'm trying. I've shown up, and you're not paying attention. I've jumped through the hula hoops. My wife made me come to do this. And yet still, you are not paying attention. And the question is, did the meds do the job? No, I don't want to be a zombie. Just look at me for a second. And I think that is powerful to the point of that connection, because you're too busy, doing a whole bunch of this and clacking on the computer. And the whole time, it's a 30-minute visit of you just clacking away notes. And as I'm talking, you're over here doing this. And I'm just looking at the wall going, this is a waste of my time.
Well, that's why I apologized on CNN.
Yes. So for those there, and we'll link that. There was a special that Dr. G made on CNN when he was with Don Lemon, and you did make that public. And I'll let you kind of say it again, but I thought that was really profound and courageous of you to take that stand and apologize for the community for doing that thing. Can you talk a little bit about that?
Yeah. Well, what happened is I went to a retreat for wounded, traumatized warriors outside of St. Louis. And I was the only non-military person there. And I gave a presentation or an interaction, and it went terribly. And what some of those veterans told me, they said, "Nothing personal, Doc. You seem like a good guy, but we don't like psychiatrists. First of all, you're not military. And we don't like psychiatrists because many of the ones we see, they're not bad people, but they're checking boxes, they're filling out things. Some of them are chewing gum, some of them are taking calls. We're like things. And so nothing personal, but you already had too many strikes against you." And it was a 2-day thing, and I was supposed to give 2 presentations. And so the first one just went south. And the second one, I just changed it. And I said, I want to say to all of you, there's about 60 people there. I said, even the most disabled of you has done more for this world than any of my colleagues. And you deserve better. And when I leave, I'm going to write to the American Psychiatric Association that I belong to that you deserve better. And maybe someday I'll get the chance to tell the world that you deserve better. And then I was called on Don Lemon when it became, when they changed the criteria for PTSD, where you didn't have to humiliate yourself to prove that you had it.
Yes.
And I just kind of overjoyed, I rejoiced at that breakthrough, because who needs that humiliation? And then I caught him off guard, and I said at the end, I want to take this opportunity to apologize to the armed forces for my profession. So there was that segment that I'll send you. But I want to get back to that slide that I showed you, because we got on a tangent. And so if you can remember the 12 phases, so this is how, why cope when you can heal works.
Yeah.
So as we're hopefully going to put together pilot groups, or if you're doing this yourself in a journal or with a therapist, as you go through those steps, the horror, the terror, the fragile, you can become triggered. And what we have is something called the distress relief exercise and journal.
Okay.
And I think journaling saved my life, because I showed you, one of my journals when I finished medical school, and I wasn't a writer. I was a doctor. I took out a crappy little journal and I wrote down, I can't believe I made it through. They've released the crazy person. And I'm on volume 255, 45,000 pages, 9 books, 1,200 articles. And I'd become a writer and an author when I just started out saying, I can't believe I made it through. So a distress relief journal, and you can see the one that I have is I have a picture of the dean of students. And so whenever I'm upset, now I can do this without the journal because I've done it hundreds of times, but I picture that person. So if you're watching or listening, picture a person who was there for you. And if you didn't have someone like that, when I do this with youth in the inner city, I say, put a picture of LeBron James there. It doesn't matter. Because they would say this to you. And imagine just when you're upset about something, they say to you, you can do this. So Dean McNary is saying to me, you can do this. And then he says to me, write down the date and time. Because you're going to keep this journal.
And so now I'm writing down the day and time of right now. So I've experienced what I'm feeling. So I'm writing out today. Today I'm making this journal. I have my picture. I'm writing down today is XY date. Got it.
Right. And then the second thing is imagine that person saying to you, what just happened? And then you write it down. And again, you don't want to make this something that's a chore. And then the next step 3 is what did you think when it happened? So for a lot of us guys, we think more than we feel. But but if something upsetting happened, what'd you think? I thought I'm going to get fired. I thought, I'm never going to get out of this. And then the next step is, what'd you feel when it happened? Scared like I'm not going to make it back. And then the next one is the most important step. What does it make you want to do? So that's where you put the impulse out into words. Feel like running away. Feel like getting smashed. Feel like smashing my car. And then imagine that person, Dean McNary, saying to me, in my mind, he died many years ago, take 3 deep breaths, Mark. I can feel him. And then he says to me, what would be a better thing to do? Well, the better thing to do is having this conversation, remembering someone living or dead who cares about you or cared about you, because he's talking me from DEFCON 1 to DEFCON 4. And why would that be better? Because as I feel gratitude, appreciation, and missing him, I get a wave of something in my body called oxytocin. Oxytocin is bonding. Oxytocin is what allows a young mother to still be patient with a screaming infant because of the oxytocin.
Yep.
But men have oxytocin too. And oxytocin counterbalances high cortisol. When we're under stress, cortisol goes through the roof. And then the cortisol triggers us into, DEFCON 1.
Mm-hmm.
But when we feel oxytocin, as I did just remembering him, even now, just going through it with you, I'm remembering him,
Mm-hmm.
Balancing that with Larry King being gone a few days ago and just remembering Dean McNary, I'm just flowing in oxytocin and just appreciative of both of them. And so that is the exercise when you get triggered going through the 12 phases. Mm-hmm. And then the final slide that we talk about in the book is something called the 12 words. Because there is research that shows that when you can put an accurate emotional word on what you're feeling, it lowers agitation in your brain by a third. So when they try to teach kids, use your words. So, when you can say the word, and there's a video that I draw people's attention to, and you might be too young, but I'm old enough, and I was a big fan of the Rocky movies. And there is I think it's Rocky 3, and there's a famous scene where he gets beaten by Clubber Lang, and he doesn't want to fight again. And there's a famous scene, you can look up, Rocky 3 beach scene. And he's training, but his heart isn't in it. And then his wife confronts him and says, Rocky, what is it? And he gets argumentative and whatever. And she keeps pushing. Rocky, what is it? And then she won't let go. And then there's a point when he's on the beach. He said, you want to know? I'm afraid. That's my feeling. I'm afraid.
I'm
okay?
afraid.
Everything that was right is wrong. Okay, I could lose it all. I'm afraid. And then she comes back and she says, "We're all afraid." And then that's of course the turning point in the movie. I'm going to have to watch it again. But the point is, when you can share whatever the feeling is, it also helps you to calm down. So here are 12 feelings, and there could be other feelings, but the ones we ask people to write down when they're triggered, what are you feeling?
Yes.
Anxious, afraid, overwhelmed, fragile, depressed, frustrated, angry, ashamed, alone, lonely, exhausted, numb. Do you follow me? And then if you can begin to sort of say, and you can say angry, okay? Right. Or what is it? Yeah, angry, okay? Good. How angry? What's the most angry you can feel? Blah, 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 blah. Take me to the last time you felt it.
Yes.
And see, I'm drawing you back to when you felt that awful feeling and you felt it alone. And then when you tell me about the last time you felt it, something magical happens, DP, because if you tell me and I push for details,
yes,
and you say, okay, you want to know, it was 4 days ago, it was 2:30 in the morning, and I just had it. I'd had it. I couldn't get back to sleep. I didn't know whether to put my head through the wall or jump out a window, and I just had it. And my meds weren't working, and I was just walking around my room, and I was stomping. I didn't want to wake up everybody. I just had it, and I didn't know how I was going to make it. And I'll tell you, I just thought I was coming out of my skull, and then the sun rose. But can you see that if you get someone to express the feeling and take you there, they feel less alone?
One thing we talked about this like a week and a half ago was the feeling chart, which is an expansion of that, which really kind of dives deeper into those specific feelings, which we shared. which I thought was interesting because I would have never really thought about that, which again is about giving words, right? So, for example, switching the same exact thing, giving more words to that, right? What does this angriness feel to me? And really being able to look at what are those other things, like for the self-assessment side, the same thing you said, I'm angry. What's happening after that? Do I feel let down, humiliated, bitter, mad, critical? Beyond that, betrayed, resentful, disrespected? We literally just had a conversation about that. And I think to the point, to validate that from my side, I think it's just powerful to be able to have those conversations and, have that. Again, if you're by yourself journaling and you want to put words to that because you may not have someone to ask that question. I think that also goes, Mark, to a point you mentioned about General Steele and his ability to reach down and talk to people, if you want to touch on that, because it really kind of segues perfectly into that digging aspect that he was masterful at with the troops.
So General Marty Steele was the COO of the Marines in the 90s under Commandant Chuck Krulak. And there's actually a book called The Boys of 67 that talked about 3 special Marines in Vietnam. I think there's another book, but if you check it out, and one of them was, I think, Jim Jones. I may be getting it wrong. He became a commandant, but one of them was General Marty Steele, when he was in Vietnam, and it tells their story. And he was the COO of the Marines in the 90s, and then he was the CEO of the U.S. Intrepid, the aircraft carrier on the Hudson.
Yes.
And then he had a transition program between 2006, 2008, when the last financial crisis happened, and then it ran out of funding. And in that transition program, and I was helping him, we were working together. I think it was either a 10-day or 2-week program when Marines were transitioning back to civilian life. And what the Marines rated as the best part of that program was the 1.5-hour one-on-one time they each had with General Steele. I think about 600 went through it.
Wow.
And I asked Marty, Marty, what'd you talk about? And he said that he had the rarest Myers-Briggs profile in the Marines. I forget what it was, but it's an intuitive something or other. And he was a fan of Myers-Briggs because he felt self-knowledge was helpful. So during the transition program, we'd train these Marines in Myers-Briggs so that they could have self-knowledge, and then train them about, how to change their language when they became civilians. But I said, what did you talk to the Marines about? And so here's another example of surgical empathy. He said, well, I'd ask them the 5 reallys. And I said, what is that? He'd say, we call each other Marine. And I'd say, Marine, how you doing? Or what's going on? And they'd say, well, I'm okay. It's a little bit of a transition. And, sometimes it's frustrating. And then he'd say, well, I understand it's frustrating and it's a transition, but what's really going on? Mm-hmm. Well, I'm argument there. And, people at home don't really understand what we've been through. And he repaid back, I understand you're getting into arguments, but what's really going on? And he said, when you get to about the 5th really, they'll look at you flat out, and some of them will say, I saw and did horrible things, sir. And when I close my eyes, I see them more vividly. So I don't close my eyes much, sir. And he would say to them, if you're an active duty Marine, we've all saw and done horrendous things. And I'm giving you a direct order to put those aside because we've all been through that and you have earned the right to a life. Do you understand me? It was a little bit like what Dean McNeary said to me. And he got letters for years from spouses telling him that he'd saved their spouse's life. Wow. But that's another example of surgical empathy, is you're talking to someone and you get them talking, and it's amazing when you hit rock bottom and people tell you their truth and you're receptive and you don't jump in to say it'll be fine. It gets to the bottom of the abscess. Yes. And then when they do that and you can just give them the space to express it and relive it and feel it, it gets it up and out.
And I think that's powerful because it goes to just tactical things. Some would call that peeling back the onion layers or being persistent. Mm-hmm. But I think that I want to say that there's a care that has to happen. Some would call it, empathy, yes. Some would identify as being empaths. But when you're dealing in a space as a first responder, as a leader, as someone working with individuals that may be coping or dealing with things, I think it just is due diligence to understand that, yes, it's not just about peeling back those onion layers, because the other side of that, too, is using the words of surgical empathy. You're getting really deep to that pain point. And I think that we have to be very understanding and cautious of the boundaries and the care that we are literally taking. Literally, you have someone's heart in your hand to a degree. You've asked me the 5 reallys, Mark. You sat with me and I'm opening up. You're looking at me, and literally in that moment of vulnerability, you have to have care, because to your point, some patronizing comment or a little, it'll be all right, just buck up, will shatter someone to a degree because of the fact that they've opened up. And I think it's one of those things where understanding that tactic and having empathy and just being able to take some of the points that you've written about in your thesis and what you're sharing today can help first responders, can help leaders today who are serving, who have those troops who may have come back, or those veterans. To your point, I think there's a Vietnam veteran out there who needs to just be told a direct order. It's okay to be broken, but now you can get better. Sometimes it's one of those things of all you see is Jim is 67. But that's that 17-year-old Jimmy who just still is stuck like the mannequin, like the doll you mentioned. And literally the 5 reallys, or having someone speak that life into them and saying, Jimmy, it's okay, right? And being able to just honor that space and have that conversation, I think is impactful. And especially for the veteran community, where many, again, yes, right, we want to break the stigma of being disabled, but you're not unable. I would always equate this, and I want to take your point on this, Mark, is if I crossed the street and a car hit me, you wouldn't call me a limp. I would just have a limp after the surgery. There may be traumas I deal with, but I'm not MDD, major depressive disorder. I'm not PTSD, but I deal with those things. And like the body, you can have maybe loss of certain functions, but muscles can build around it. Physical therapy, right? To be able to regain the ability to walk again. Yes, there's a little limp in there maybe. Things may not come back the way they were, but you can still move forward. Not negating where it came from, but now it's just part of who you are as a person. And I think when it comes to mental health, many of us begin to just identify as that, to the point of coping, right? Like, no, Mark, I'm fine. No, you've packed it away. Those things are still there, festering and seeping in different ways. And I think the things that you've shared today are powerful, because for many, it's coming to a place of saying, do I still have to identify with this? Look me in the eye. Am I PTSD? Am I the monster that blew up in front of the kids and now I'm beating myself up constantly because I said that thing? That's the reality that many of those that may be listening now are dealing with. You don't know who Jim is. He did not come back from Vietnam or the Gulf War or Iraq the same. That son that came back a little bit different is a shell, that doll, like you mentioned, and being able to at least have these conversations. To your point, feeling something again. By far, I could tell you, I could, overanalyze something. I can think about something, but you ask someone, how are you feeling today? That's a whole different question, because you can look at someone in the eye, and I've seen it. I've asked people questions. And I'll ask them and I'll say, Mark, how are you feeling today? And you just stay there. And you just see everything begin to slowly come down, because like you said, right, they're gravitating to that magnetism of you're there. Are you actually listening?
So here's an example of clinical versus surgical empathy. And it's subtle and you have to get used to it. So I want you to imagine you come in, and you're traumatized and you're depressed, and here's clinical empathy. How are you feeling today? And you'll look whatever, well, not so great. Or I might say, are you feeling depressed? And you'll say whatever. And that's responsible, and I can check a box. But imagine if instead, DP, you come in and I say to you, you've been feeling depressed lately, haven't you? What? It's okay. You've been feeling depressed lately, haven't you? Yeah. And you've had some low points that were pretty scary. Is that true? Yeah. And maybe some points in which you didn't know if you could just keep going on. Is that true? But can you see one is inviting you? It's professional, and I can write it down on my chart, but the one that's inviting you.
Yes.
And you could say, no, it hasn't been that bad. Well, I'm glad to hear that. And there's actually something that I teach from Just Listen when you want to open people up. And I don't practice it enough, but there's a chapter in Just Listen called Fill in the Blanks. And fill in the blanks invites someone into a conversation with you. With if you ask them a question, there's a barrier between you and them. So here's the difference between asking a question or fill in the blanks, and see how it lands for you. So if I were to ask you, have you been feeling depressed? Have you been feeling anxious?
Yeah.
Perfectly great question. And you might say yes, which allows me to write it down. So fill in the blanks would be DP, you've been feeling what? Do you see one invites you into the sentence?
Yes.
And when it gets really bad, that causes you to what? So again, obviously, I could have changed the distress relief thing into fill in the blanks.
Yeah.
So
but I want to honor that though, because just even receiving and hearing that, the subtle difference, the guard is, are you feeling this way? Yes. Or do you feel this way? Versus that subtle kind of like fill in the blank where that olive branch is there, that kind of makes me lean into it and want to fill in the blank, because deep down inside, no one cares about me, Mark. No one cares about what's going on. But when that question was posed that way, it's almost like it's like it just almost escapes you to a degree of like, that fill in the blank piece of like what I've been wanting to say or someone to ask, but I didn't know how to answer it because I have to defend myself, because I have to be strong, because I have to be all these things, because as a minority, we don't show weakness. As a veteran, we don't all those things just with that simple, and it makes you feel.
So let's try this on given your mission.
Yeah.
So if I do the question versus fill in the blanks, tell me how these land. So I'm hopefully giving people tactics they can use.
Yes.
And if I were to say to you, do you care about the pain and suffering of veterans?
Yes.
You would say, what?
Yes.
But if instead I were to say, you care about the pain and suffering of veterans because...
I don't want them to feel the way I felt. I know what that pain feels like.
Yeah, when you said that, my eyes almost watered. I just felt it. Could you feel the difference?
Yes.
So it's using actually the way we use sentences. A question is perfectly good, but when I ask you a question, it means, is there a right or wrong answer?
Right.
Do I have to evaluate this? But when I said, you care about the pain and suffering of veterans because, and your voice got softer, and what you said is, I don't want them to feel that way.
Right.
So there's all different kind of cues. And if you like that, by the way, Just Listen, that's why it became the top book on listening in the world. It's in 27 languages. So it's filled with all those kinds of things.
And I want to bring that up as well for those that may be saying to themselves, I need to get my hand on some of these. I want to be able to show different locations and places that they can find your work. So at markgoulston.com, they'll find your website, your blogs, videos, testimonials, and books that you've written. And here a plethora of information. But I want to hop very quickly also to Amazon, where literally a quick search will have all the books, right? Because everybody wants Prime and everybody wants a quick, next day delivery. Here you have the books that you've written available as well, that folks can look into in different languages. Trauma Triumph, Why Cope When You Can Heal, Just Listen, Get Out of Your Own Way. That in itself is a whole other conversation. And for those that are on LinkedIn, they can find you there as well, and some of the work that you've done, speeches and so forth, available, and live events that you do. But again, I just wanted to highlight this for folks that are watching who want to find out more information, where they can get you and find more information on the books that you have.
Well, thank you. Thank you for taking the time, and thank you for not falling asleep during our conversation.
Oh, no. And again, as we kind of wrap to a close here, in honoring our time, this is the first of many conversations. One, I appreciate your time, as I've said to you before. I believe at times like-minded individuals kind of come together for a reason. And I think these are the conversations that have to happen. And I really wanted to let you speak about what got you to this point, because it helps to quantify for many, because what you've shared, even from your journey, for me, it wasn't a rant or a tangent. It was more the point of, but Doc, you're not one of us. You don't get it. But the story you shared makes me relate to the fact of not having that purpose. And for the veterans, that for us was service. And the disconnect is when that no longer was my identity. Doc, you don't understand. I was a Marine. I was an Army. I was a sailor. And I am no longer that thing. And now what do I do? What is that separation anxiety? What is that adjustment disorder that's morphed into these things that might be labeled, but I'm hurting. And I don't know how to say that. And that's a good segue to the project that we want to work on, which is a Hurt Locker. And having conversations about pain. That's why the number's above for those, because it's a topic that for some can be triggering, but we want to do it in a way that's honoring and respecting those out there. To when you're ready to absorb this, I want you to understand where it's coming from. That's why this becomes part of the mission to have this conversation. And as we move forward into projects of having case studies and the Hurt Locker, now folks can come with an open mind to say, okay, now I can walk away with some tactical things. So please, not at all. I'm literally a student of the game, and this is how we learn to be able to help someone so they don't feel that pain anymore or feel the despair that no one cares or is listening.
Well, and I'm looking forward to the Hurt Locker, and we'll just give you, we're totally transparent. And so one of my mentors, the Dr. Schneidman, who was a suicide expert, what he would ask patients or people he would see is these simple questions. What hurts? Where does it hurt? How much does it hurt? And when it hurts most, how alone do you feel? Take me to the last time it happened. And that's what we're going to do.
Yes.
It's and people are going to share that.
Yes.
And as they share that, you're going to be in a supportive atmosphere.
Yes.
Because I think a lot of us run away from hurt because it's like a wound. If you're a wounded animal, especially a traumatic wound, you think the next wound's going to kill you.
Yes.
So we run away from hurt. But the point is, the more we run away from hurt, the more it can stay, build, and get infected. It's like an abscess. And so the Hurt Locker is, we're going to collectively go in there with each other, and we're going to start to heal each other from the inside out.
Yes. And that's a journey, Doc, that I'm blessed to be a part of and join you in, because I think, again, these are the conversations that have to happen, are the conversations that are not easy. They're not the fun ones that folks are going to want to tune in for. But I want to, right now, as we close, one is give permission to those that are watching to watch this and absorb this, right, when you're ready. And what I mean by that is, back to General Steele's point, being here, If you have to go to a closet, do that. If you have to go sit in your car to watch these things, do that. If you have to go somewhere where you feel safe or you can have true moments to absorb this information, we are giving you the permission to do that. You don't have to watch it right now, right? So we're doing a session of the Hurt Locker and we're talking about these things. The preface of that is make sure that you're ready to enter into the space, because it's really going to heal you if you're ready to absorb that and get the information and not just watch it where you don't want to. Like, it's not a Starbucks video to watch. It's not a Starbucks conversation to have. And I'll tell you, Doc, we've had instances where we've had panels on military sexual trauma. And the very first thing we've said is, when you're ready to watch this, do that. And we have had veterans reach out and said, I literally stopped the video and I went to my closet and I sat in there and cried. And I heard the stories of military sexual trauma victims sharing their journey and how they got out of it, and it helped me. And it goes back to that permission of saying, you can take the time you need to be able to absorb this, because that's how truly it's going to help. Because if not, like you said, right, we're wounded animals and we're just guarding. I can't let my guard down. I'm still in the wild. Find a safe space wherever it may be. And this technology lets us have this conversation that many of you don't even know is available. So for that, I thank you, Doc, because I think, again, this is truly paying it forward and having the conversations that are needed.
Well, this is just the beginning, my friend, and
Yes.
Let's go out and see if we can start healing some people.
Indeed. We'll be back for more conversations with me and Dr. G. I appreciate your time. Share this. We look forward to many more conversations as we begin to make change. Dr. G, as always, I appreciate you, my brother.
Thank you, my brother.